Sa waka, yupiu ko, abuganao ko. I am Yupik Eskimo. My Yupik name is Abuchen. I am named after my maternal grandmother. And I'm originally from the village of St. Mary's, but I am in Anchorage, Alaska. My English name is Elsie Boudreau. And so I'm really, really happy to be here. I'm part of the Tribal Victim Services Training and Technical Assistance Team, or T-VISTA for short, at the Office of Victims of Crime. So we know that human trafficking and victimization are difficult topics. They're hard to talk about. So as we move through this conversation, if you need support to talk to someone, please contact Strong Hearts Native Helpline, and their information is in the chat. And please do take care of yourself. That's really, really important. The National Human Trafficking Hotline is also a resource if you or a loved one experienced or are experiencing human trafficking. So know that all conversations are confidential and anonymous. So our conversation today is about standards of care for survivors of human trafficking. As a brief overview, human trafficking is a crime. It occurs when someone is used for forced sex or labor. Any child under the age of 18 exchanging any item of value for a sex act is protected by law as a victim of human trafficking. Standards of care focus on promoting a consistent quality of care for survivors of human trafficking. These standards can help advocates and partner organizations better understand how to walk alongside a survivor of human trafficking during their healing journey. We look forward to hearing your questions and our panelists' perspectives during this discussion. Now, I would like to welcome Sarah Gilmer, Deputy Director, OVC Human Trafficking Division, to offer some welcoming remarks. Sarah?
Thank you, Elsie. It's a pleasure to join you for this talking circle, and thank you everybody for the work that you do each and every day to offer healing in your community. We're so grateful for that. The Office for Victims of Crime, or OVC, promotes justice and healing for victims of all crime. Our primary focus is always on the victim and survivor well-being. As a partner to tribal communities, OVC honors and respects tribal sovereignty, listening to advocates and tribal leadership as they share wisdom and insight on best practices and victim service needs. The need for standards of care, the topic of today's discussion, was first identified by survivors and anti-trafficking advocates. Human trafficking survivors have diverse needs and may seek and receive assistance from a wide array of organizations. Standards of care can help ensure all survivors of labor and sex trafficking receive trauma-informed care, no matter who delivers the services, and avoid re-traumatization during their healing journey. Standards of care can create a shared understanding of the bare minimum that might be required to provide victim-centered responses to survivors, as well as highlight the possibilities for supportive and innovative service delivery beyond those baseline standards. OVC and the Office on Trafficking in Persons at the Department of Health and Human Services are working together and have provided competitive funding to Freedom Network USA, the nation's largest coalition of service providers and advocates working directly with human trafficking survivors, to develop standards of care to promote consistent quality of care and reduce potential harm to survivors. These standards of care will encompass a comprehensive array of services that survivors need. The work is still in early stages, and this conversation is an opportunity for you to share what is working in your communities in the chat and to ask questions. Vanessa with Freedom Network is here as a panelist and will share the vision for this framework to be developed by the field, by you, for the field. Please share your questions in the Q&A as Josie asked, and respond to the closing poll if you'd like to receive further communication about standards of care for survivors of human trafficking. Again, thank you for the healing and transformative work that you provide in your communities every day. And Elsie, back to you. Thank you.
Okay, so as a reminder to our participants, you can submit your questions for the panelists in the Q&A feature at the bottom of the screen. And I'm happy to introduce you and welcome our moderator, Ingrid Cumberledge, who will introduce the panelists and guide our conversation today. Ingrid, over to you.
Thank you, Elsie. Ong Ong, and hello and welcome to all of our participants. My name is Haika, meaning dog salmon in my Anungan language, and Klunkagoont in my Tlingit language. I'm from the dog salmon raven family. And I grew up in Sandpoint, Alaska, commercial fishing and working as a teacher and a tribal court judge. And I'm happy to sit as a tribal advisory member on the Human Trafficking Capacity Building Center, who is bringing this with you with the coalition. So I currently am your U.S. Attorney's Office here in Alaska, the Missing and Murdered Indigenous Person Coordinator, and I want to turn it over to our panelists. Joining me are three wonderful panelists, Vanessa Chauhan, Josie Hayano, and Morgan Hawes. And I invite each of them to say hello after offering a brief introduction. Vanessa, let's start with you.
Thank you so much. Good afternoon, everyone. My name is Vanessa Chauhan, and I am the Standards of Care Senior Project Manager at Freedom Network USA. I'm fairly new to the role and to the organization, having started this position in April of 2023. I come to this role and to this work with a background in training, technical assistance, and capacity building support to diverse professional and community audiences, both worldwide and in the US, on issues of human trafficking, domestic violence, and sexual assault. Thank you for the opportunity to be here today.
Thank you so much, Vanessa. Josie, let's have you go next.
Thank you. Good morning, everyone. My name is Josie Hiano. I am Degaton Athabascan and a Tanana tribal member. I'm also a licensed master's level social worker and commercial fisherman. I am the daughter of Nina Hiano of Tanana and David Hiano of Ecock Beach. My maternal grandparents are Alfred Miller of Anvik and the late Paul and Mary Starr of Tanana. My paternal grandparents are the late Pete and Rosa Hiano of Ecock, Alaska. I'm joining you today from Seward, which is the ancestral and unceded lands of the Katuchik Native Tribe and the Alutiiq and Sugpiaq peoples. So I'm so happy to be here with you. Thank you. Back to you.
Welcome, Josie. And Morgan, on with you.
Thank you so much, Ingrid. I'm Morgan Hawes. I am the National TTEA Sex Trafficking Program Coordinator for MUSAC, the Minnesota Indian Women's Sexual Assault Coalition. I'm also new to the role as of June 1st, so very excited for this opportunity to share this space with you all. I'm an enrolled member of the Picayune Rancheria of Chukchansi Indians in Oakhurst, California, and I come with a background in evaluation, policy, and research related to domestic violence and sexual assault.
Thank you and welcome, Morgan. We are so honored to have each of you here with us and to share your knowledge. I'm excited to learn from all of you. To start a discussion, I'd like to ask you a few questions of my own, and then following those opening questions, we'll shift to your questions. Again, please enter your questions at any time through the question and answer feature at the bottom of your screen. I think Elsie has been telling you the chat too, so however we want to do that. Vanessa, I'm going to start with you, if that's all right. How will standards of care be developed, and why are they so essential in supporting victims of human trafficking?
Sure, thank you. So as Sarah mentioned in her opening remarks, Freedom Network USA will lead the development of the standards of care. We have convened a technical working group of 25 subject matter experts, including lived experience and survivor leaders, social service partners, and researchers who will help co-draft the standards of care with us. The technical working group is inclusive of individuals who identify as BIPOC, including tribal communities, immigrants, and people with disabilities, and is intended to be a representative and collective body with the expertise, nuance, and diversity of the human trafficking landscape in the United States. Freedom Network has contracted with RTI, a research organization, to conduct a literature review of what currently exists and to propose a process and a criteria from which to draft the standards of care. These standards are meant to be developed for the field, by the field, and as such, the larger community and public will be engaged throughout the drafting process. Once drafted at the end of the 3-year funding period, which will be September of 2025, the entire resource will be available to the general public for review and comment. The goal is to make this process as transparent and inclusive as possible, and to also produce a resource that can be adaptable and customizable to diverse settings and service structures around the country. Regarding your question about why standards of care are essential, they're essential because we want to ensure that no additional harm is caused to or endured by survivors of trafficking. The goal of this project is really to provide practical guidance on implementing programs that are person-centered, trauma-informed, culturally responsive, and resist harm. Survivors of human trafficking have diverse needs and receive assistance from a wide variety of organizations with diverse experience, expertise, and services focus. Service providers have a responsibility to ensure that any services that they provide are based on a thorough understanding of trauma and that they do not cause any harm to the beneficiaries of their services. And so it's important that every entity or individual that interacts with and or serves survivors of human trafficking do so in a way that centers equity, choice, and individualized care and support. Thank you.
Thank you, Vanessa. I'm so glad to hear you say that. I'm just sitting at an OVC consultation, and one of the issues raised was that we often are providing care with the same brush that we do many other cares. So I'm glad to hear you talk about that specifically. Morgan, we're going to go to you next. How can programs build on a current best practices in delivering services, applying existing expertise and wisdom to support survivors of human trafficking? What might a standard of care look like for survivors?
Thank you so much. So first, I would implore programs to really think meaningfully and intentionally about how they are defining and applying best practices with regard to service delivery. So if the goal is to amplify the voices of survivors and honor their lived experiences, it's important to consider the impact that current programming and services have on survivors and the community at large. For example, when it comes to service delivery, when we're looking at current best practices, are they victim-centered? And do these best practices respect and incorporate traditional ways of knowing and healing? Have we evaluated these services from the survivor's perspective? And when we talk about applying existing expertise and wisdom, I think it's important to acknowledge that our understanding about the needs of survivors is constantly evolving. So as a result of that, we should really keep emerging issues at the forefront of our minds and our hearts, and be making connections with additional knowledge keepers and developing strong relationships based on truth, trust, and transparency that will really help us to engage with this work on a deeper level. And when it comes to a standard of care for survivors and what that might look like, I think that for survivors of trafficking, this should be comprehensive and collaborative, speaking to what Vanessa said. Survivor-led, victim-centered, and this approach, the delivery, should be really curtailed to meet the needs of the survivors and communities that we're serving. And so being trauma informed and reducing harm, but also promoting health and healing for the victim, survivor, and community members.
I'm excited to hear about how we're going to meet those needs. Thank you for sharing that. As a reminder to our participants, I just want to remind you to please submit your questions for the panelists in the question and answer feature at the bottom of your screen. We've had several come through, and we'll be getting to those after we finish with these opening remarks. And we'll go to those next. Josie, how can service standards reflect the diversity and the needs of American Indians and Alaska Natives affected by human trafficking, such as youth, two-spirits, those with disabilities, and elders?
Thank you, Ingrid. I want to back up just a second because I think as our participants start to think about questions, it might help for them to know the lens in which I come to this work. So before I answer that, I do want to share that I've worked direct care in the anti-trafficking space for many years now, most recently as a mental health clinician working with youth who experience homelessness and trafficking. I also want to share that I'm a presidentially appointed member of the United States Advisory Council on Human Trafficking. This council is a formal platform for trafficking survivors to advise and make recommendations on federal anti-trafficking policies to the President's Interagency Task Force to monitor and combat trafficking in persons. I'm sharing this with you today to bring awareness to the council's work and to note that, to my knowledge, I am the first Indigenous member of this council since its inception in 2015. I truly hope that in the future there will always be Native representation on this important platform. That being said, I'm here today as an independent consultant, and my thoughts and experiences I share with you are not representative of the council in any way. So back to your question, Ingrid, I really want to first uplift the comments made by Morgan and Vanessa. So well said and completely relevant to this question as well. When we talk about service standards, we're talking about the basic principles of ethics and care, something that in the field of social work, we're really familiar with, but it can be a new concept for those of us who work in different spaces. So the idea is that the basic element of care that are human rights, regardless of culture, identity, gender, age, and ability, are cemented into our practice for all who receive services. The question you asked me is about diversity. Our diversity as Native people is beautiful, needed, and sacred. When we talk about standards of care, we don't mean simplifying our practices to minimize our differences. It means uplifting the knowledge that we've always had. How we steward the care for each other and our communities is not something new for us. Our elders taught us our standards and values already. I was taught to work hard, to value my family, to love, respect, and care for others and children, to value humor, honesty, and fairness, and to have respect for the knowledge and wisdom that comes from life experiences. I think as we move through today's discussion and consider what these standards could look like for our communities, I want to encourage you all to value that ancestral knowledge that you and your people already hold. While this discussion around standards of care is relatively new in the anti-trafficking space, and this is a topic that is a complex social issue that challenges all of us, have faith that the wisdom held in Indigenous communities is the key to creating benchmarks and service standards that will represent us and how we serve and care for all of our people. In all of my years working with Native youth who have experienced trafficking, I've learned that there is no healing that exists within institutions and services that have not been built with those youth's existing wisdom and strength in mind. A standard of care within my own practice is the respect and dignity of every client to know their own individual path to healing. That means that sometimes my clinical treatment plans do include berry picking, big belly laughs, and tea and dry fish. Thanks, Ingrid. Back to you.
Thanks, Josie. I was just talking about berry picking today. It's getting close to that time, I hope. And such a healing activity. Morgan, I'm going to go to you with this one first. When referring to standards of care for service providers, does this group include healthcare providers such as forensic nurses? And if you're not comfortable with that, we'll go out to the others as well. Go ahead, Morgan.
Yeah, so thank you so much for that question, Ingrid. It does. I think that it applies to all of the service providers that are coming into contact with the survivor, right? Because that experience is really built around all of those different connections and all of the service providers and the delivery experiences that this individual is going to have during the course of them seeking out different services in their healing journey. So yes, it does. And I think that, it's really important to deliver services and to think about standard of care in terms of solidarity. So consistency and really being able to deliver those standards in collaboration with the other service providers, that coordinated approach is important to consider.
Thank you so much. I appreciate that answer. Josie, the next question I want you to consider is how would the standard of care be different for non-natives?
Thanks, Ingrid. Yeah, I saw that one pop up in the chat. That's a really good question. I think, I don't know how different they would be. And I think as we work as communities to develop, we're going to find a lot of similarities in these standards of care that really come back to just core values in humanity. And I think part of my point was to encourage us to look at our cultural norms and our cultural values that exist already and use those as guides to help develop these standards for how we serve these populations. I think regardless of being a Native community or non-Native community, our cultures in which we live and we exist do have values that guide us and support us. And I think that those principles can really help be foundational in how we implement standards of care.
Oh, thank you. I appreciate that answer.
Do you mind
Vanessa,
if I add a little bit?
Yes, please.
I
Go
think
ahead,
just
Vanessa.
to enhance what Josie said, she's absolutely right. Like I think we're approaching this from, there's already some really amazing work that's being done all across the country. And I think our approach with this Standards of Care project is not to start from the beginning, right? It's to already take what's happened and is happening on the ground and learn from one another and really create resources that can be of utility to organizations already providing services, either help lift them up in the work that they do or provide some, as Sarah again mentioned, about that baseline of what does it mean at the core to provide services to survivors of trafficking. So we're really hoping that we are able to infuse all of these different cultural nuances, values nuances, working with diverse populations into the work. And why we're proactively participating in these conversations and encouraging everyone to be feel like they're a welcome member in this process, because we really want to make this a product that's useful for the field, that will also be a living, breathing document, as Morgan mentioned, because things are always changing and evolving, and it's not a static resource. Thank you.
Thank you. I appreciate that. And I think that gets partly to this question. So I'm going to give this question back to you, Vanessa. Can you discuss the stigma associated with human trafficking survivors? How are the survivors received by both the local and Native communities? And I know the Freedom Network is assessing a little bit. Do you want to respond to that one?
I can certainly start, but I'll also look to my co-panelists to please make the response a little bit more robust. I think there's a lot of, I think the level of awareness and understanding about the issue varies across the board. I think we're also in an environment where there's a lot of misinformation about trafficking. So I think the stigma comes with a lack of understanding, but then also an awareness of shame, not feeling like there's a safe space to be able to share that information without judgment, without any kind of repercussion, and knowing which actors are a safe space. I think, we've approached this issue at several times from a criminal justice approach, and we're taking a step back from that and looking at this issue from a public health approach and a human rights approach, and really centering survivors and their experiences throughout this whole process and trying to find those safe spaces, trying to equip providers and professionals and communities with the correct language to help survivors. And if they're not able to help directly, to be able to help coordinate or facilitate connections with those that can. So I think we're starting to see a lot of self-awareness within the field about harm that has been done, may continue to be done, and like really pivot and focus on that strengths-based approach of centering survivors, listening to what it is they want, and really tailoring the responses that are provided, regardless of where people fall on the spectrum of services, because survivors come with a swath and a wide array of needs that they need to help sort of alleviate that stigma, but then to also help provide a safe response that they volunteer towards having. So that's what
I'm so happy to hear that, because often in our listening sessions, we hear survivors, really concerned about going home and the shame of it. But what we have heard from our tribes and our tribal people is there's nothing they could do that wouldn't allow them to come home. And we want them home, and we want them home, and we want them safe to take care of them. Josie, any follow-ups?
Yeah, thank you, Ingrid. Well said, Vanessa. I want to add in there, we've talked a little bit about how we engage survivor leaders and survivor activists and lived expertise people within these spaces as we develop the standards of care. And I think it's really important to be aware of those stigmas and to be aware of how people are received within their communities when engaging people in the work. I think one of the most powerful things that I have seen done in my community is agencies opening up this work to survivor leaders in a way that's really diverse. That means that someone can say, I have this lived experience in trafficking and I want to contribute to this work because it's meaningful to me, but I don't have to do it on a platform or on a stage. Maybe I can do the back end data work. Maybe I can help with some of the research and program development. And so allowing for those survivor voices and leadership to be in more than one aspect of that development, I think is a really important way to engage the survivor community.
Thank you for sharing that. Morgan, did you want to contribute to that question?
Yeah, absolutely. Thank you so much to the other co-presenters, because I think this information is just amazing. And I'm so glad that we're able to have this space to provide and share this discussion. So I think that, absolutely, there's definitely a stigma associated for human trafficking survivors, and that's at the local and, the community level within Native communities, but also federally, there's a stigma attached as well. So we can acknowledge, I think, in this space that does exist. And I think that, something that's really important to consider is meeting the survivor where they're at. How is the individual defining themselves? How do they want to be perceived, right? How is this stigma affecting them? Really assessing, how can we provide services given that the stigma does exist? And this is going to vary what that looks like in every community. So part of that to me is really education, right? How are we sort of calling people into the work and educating others in the community? And to what degree do people feel that they are able to really contribute and also understand these issues that do exist, and how do community members feel that they can be supported, but also support the survivors within their own community.
Oh, I so appreciate all your responses in that. Thank you so much. Morgan, I'm going to come back to you with this one. And I really want to say thank you to all of the participants who are putting these great questions in the chat and in the question and answer. They've really been helpful. Continue to do so, please. Morgan, do you include human trafficking, or are you aware of human trafficking of benefits in your definition? Assisted living facilities, taking in residents, SNAP, disability benefits, including selling the residents to other facilities. Oh, that's a challenging question. But do you want to take a stab at it?
Yeah, can you repeat that a little bit? Because it felt a little fragmented in my mind. So I was actually looking in the chat.
I think it is a little fragmented, but let's give it a shot again. It says, do you include human trafficking of benefits in your definition? assisted living facilities taking residents SNAP, disability benefits, including selling the residents to other facilities.
This is a complicated question. I mean, I think, from my perspective in terms of what's included in trafficking, I mean, coercion, fraud, force, anything that's going to fall under these umbrellas, right? And that can look very different, depending circumstantially, right? There's a lot of emerging information coming out about extractive industries, but certainly, like, it's really relevant to consider that trafficking, it doesn't just look one way, right? Like, there's a multitude of experiences that people have as trafficking survivors, and we have to honor and respect all of those and the varying ways that those might come to us, and that might be surprising to some or not. But certainly I think that it's important to have the space for a discussion about including additional information or knowledge or experiences that we might not have typically previously considered to be umbrellaed under maybe the typical definition of what people assume a trafficking survivor is.
Thank you. That was a good place to start with that question. Vanessa, is this included in any of your work?
Not really. I mean, I think there's more information that might possibly be warranted here to see if the circumstances of the situation, as Morgan mentioned, fit the definition for human trafficking. But I'd just like to say that trafficking, traffickers prey on the vulnerabilities that may be created by gaps in systems and vulnerabilities in others that they may see as opportunities for exploitation. And there have been instances where I've heard of situations where individuals who receive public benefits have been exploited, and their public benefits have been a mode of coercion or control in the trafficking scheme. But in specifically answering this question, I don't think I'm equipped to answer that question.
I appreciate that. Josie, is suicide prevention included in the standards of care for survivors in human trafficking, or in your standard of care understanding?
Absolutely. I think in my work over the years, that has certainly been an intersecting issue. I think when we do human trafficking work, especially in Alaska right now, I'm very aware that we are also simultaneously doing MMIP work. Those are issues that have so much crossover in our communities. And in my role, we've had several young people who've experienced trafficking that have completed suicide. And so I think when we're, from a clinical frame point, when we're developing those treatment plans, we're assessing for risk and safety, we're always having really candid conversations about suicide, about where that person is at, and really just acknowledging that sometimes people just need a safe place to be able to talk about those things. So that is something that comes up in every discussion that I have. It's something that you'll see in my office. There are posters of who to talk to, how to get resources, how to ask for help, and that there's no shame in asking for help and having those conversations. I think normalizing that conversation is a really powerful tool in this field. And I want to go back just a second, because I wanted to add on to what Vanessa and Morgan said regarding the previous question. One thing that we have seen happen quite a bit is that individuals, through the violence of their trafficking experience, can end up in assisted living homes and facilities. And I think as we start to think about these standards of care, I would urge us all to think about the care within facilities, specifically for individuals impacted by trafficking. One of the unfortunate occurrences is that sometimes these relatively young people end up in assisted living homes created for elderly populations, but maybe they're suffering from a traumatic brain injury or complex trauma and substance use. So I think it is important to keep that in the forefront of our minds as we're thinking about where do survivors access services, because it is very varied. Thanks, Ingrid.
I really appreciate you raising the point that there are so many directions that we need to be looking, and certainly in my work in MMIP that is true, And I know in our discussions about human trafficking that is also true. This one I'm going to open up to any of you because I suspect that you all have answers to it. But the question is, are there any online or asynchronous trauma-informed trainings you recommend to be used for new hires? And Morgan, any recommendations?
I can say as a training and technical assistance provider for OVW that we actually, do work with individuals who are serving, tribes and tribal communities and provide one-on-one type like advocacy training. For example, we have provided trainings looking at overviews of trafficking, specific issues related to trafficking. And if anyone is in need of resources from us, please feel free to reach out to me. I would love to connect with you. We have different resources on our website, like the Garden of Truth. So I would be happy to share those with anyone who is interested.
Thank you. Appreciate that one. Vanessa, any trainings you could recommend?
I can't think of any on the top of my head, but I know a lot exist. Freedom Network, for example, is a membership coalition, and so we have a lot of our members that have created topic-specific training tools, and I'm happy to share them following this discussion. But also, in addition to looking at the intersections between trauma-informed care and trafficking, it's also important to sort of look at these topics and cross-train, right? Like a lot of these topics are very intersecting. So learning about trauma-informed care is essential. It's very grounding, but then also what does it mean in the context of the communities that you'll be working with and serving and your role relative to providing trauma-informed care. So as you look to recommend trainings for new hires, definitely think about intersecting issues and how to cross-train across topics, because I think that will also provide a lot of richness to their knowledge base.
Thank you. I appreciate that. Josie, any trainings to add to that list?
Yeah, one of my favorites that's developed for direct service providers working in the field with trafficking survivors is, I believe, actually an OVC funded project called Project Trust, developed with the Sanar Institute. I can try and drop that in the chat for you guys, but that's a really well done training, covers a lot on just the basics of trauma and the body's response to trauma, as well as how that might look in trafficking situations. And it is developed by survivors as well. Oh,
and thank you. And not trauma specific, but definitely related. The SOAR trainings, I really enjoy those, and they are asynchronous and very topical depending on what the services are that you're providing. You can select by what type of services you're providing in those. So I appreciate all those thoughts. Thank you so much. And Vanessa, I'm going to come back to this one to you. What are your thoughts on the standards of care for undocumented survivors of human trafficking, and how, as you think about evaluation, is there any way that you're thinking about capturing those?
I think there are a lot of services that are available to survivors of trafficking, regardless of their documentation or immigration status. We're really approaching, I think a lot of great work has been done around looking at these topics of trauma-informed care, self-determination, voluntary services, confidentiality, for example, and we're trying to use that sort of an overarching theme, but then also try to distill it to what do these services look like in practice. Of course, at the initial stab of these standards of care, we can't think of every service that's available, but try to at least focus on some of the main services, such as housing, legal services, medical services, I mentioned legal services, and what does trauma-informed care, for example, look like within the context of providing those unique services. So We're trying to make these, as we're drafting, and I think Sarah mentioned, we're in the initial stages of even proposing a plan for drafting standards of care. But all of these different nuances and dynamics will definitely be points of consideration and included as we're drafting the language of the standards of care. And we want these to be inclusive of all populations, regardless of what community they represent, what race, what documentation status they have in the United States.
Oh, I appreciate those thoughts. Josie, I want to come to you with this one. How can a community adapt their standards to fit their culture and customs?
Yeah, it's a great question. I was hoping you were going to go to the one in the chat that says my background looks nice. Thank you. So I think that goes back to what we were talking about earlier. Adopting these standards to fit our community is completely necessary. We cannot have universal standards that blanket everyone because we are so diverse and our needs are so diverse. I think as my fellow panelists spoke to, the way that we adapt those to reflect our community is that they're built by our community. So I think having the stakeholders from, multidisciplinary stakeholders involved in what those standards look like, but from the community stakeholders that represent the population that's being served, that are representative of the culture, of the just array of diversity that can be within a community is the most important thing.
Thank you. I appreciate that. And Morgan, the question is, we are seeing in our clients that they do not see themselves as human trafficking victims. Mm-hmm. How do we as advocates help educate without re-traumatizing?
Yeah, that's a great question. As I mentioned before, I think it's really important for us to meet the survivor where they're at, right? So if they're not defining themselves as a victim, we shouldn't be labeling them as a victim, right? We really want to be strengths-based and strengths-oriented, right? In that sort of victim-centered approach that we should be using, and uplifting that experience that the victim has had. And, maybe they're not a place where they feel that they are defining themselves as a victim at that particular point, but maybe that will come later on, right? So just giving them space to decide whether, and maybe that will never happen. I want to say and uplift that, speaking to human resiliency and just like using our compassion and really allowing the victims to sort of create that narrative, right? And we're there to respect and, provide services and be on this journey with them, but we're not directing that. That's really directed by them. It's really led by the victim. So I think that if, you find yourself struggling providing services, because there's this disconnect between, that sort of defining and education, it's okay to still educate without the label, without having to say, you're a victim or a survivor. It's okay to say, here's the information if you need it. Here's what this looks like. Maybe this has been your experience. Maybe it hasn't. Allowed the story to unfold and unravel as it happens. And like I said, maybe a different perspective will come out of that for the victim survivor, and maybe not, but really allowing them to sort of guide that process, I think is crucial.
It is very important to recognize where the victim is at and whether they see themselves as one. Thank you so much for sharing those thoughts. Vanessa, a lot of what we see in Alaska or hear about in our Alaska Native village is familial trafficking. And what do you kind of anticipate, and how are you going to measure for the different kinds of trafficking? Go ahead and give it a shot. Thanks.
So I've heard, I've heard words about evaluation being used, and I think because we're so early in the process and the project, it is definitely a consideration, but it's not in this current phase of this project, right? Like this project has quite a lot of different aspects to it. And right now we're very much focused on drafting the standards of care. But your question is great in the sense that, yes, familial trafficking is an issue that's quite prevalent across the US. We've heard a lot of mention of it. Unfortunately, there aren't too many resources that are out there around familial trafficking. I think we're still trying to build up our knowledge base and our expertise in that specific in the dynamics that are specific to that type of trafficking. But again, as we're drafting these standards, we're very much looking at trafficking holistically and trying to capture in these standards how to provide care using all of these terms of art that we like to use in the field, but how do we make the language flexible and adaptable to be able to serve diverse survivors and their needs within the context of whatever unique trafficking experience that they've had. I think if we become too restrictive, we risk not creating an avenue or a space to really identify how to provide these services in a trauma-informed way. Again, we're approaching from a sort of how do we make these flexible, adaptable, and inclusive, but then also honors all of the different variations and experiences that survivors have as it relates to trafficking. No one individual's experience is the same, right? Like everyone has a unique experiences as they're exploited through trafficking, and we want those standards to be reflective of all of these diverse experiences.
Well, I really appreciate that. I work in a world where I'm surrounded by prosecutors, and I hear them often trying to educate folks on the world that we live in rural Alaska, which is the familial trafficking primarily, and is not the taken model that we often see in movies. So I'm really glad to hear that we're doing work to develop those standards around all situations. I want to give Josie and Morgan, is there anything you want to add to that discussion?
I just wanted to say, as we already talked about, really letting the survivor sort of define themselves, like also thinking about how we're defining what we would consider to be a perpetrator, right? What does that really look like? And I think dispelling those myths that, are, really sort of being, the stereotypes that we're seeing that are being put out there. I think that that's a conversation like that needs to happen. Having that space to be able to say, well, no, and it doesn't just happen, right? And in Alaska, it happens in tribal communities all across the US where there's familial trafficking. And I know at MUSEC, that's something that we have talked a lot about is developing resources, collaborating with others who have knowledge around this particular area. And I think that we're seeing that for training and technical assistance, we have grantees that are requesting support with this particular, situation. And it's something that I think continued, knowledge sharing is going to help us sort of think about ways that we can incorporate that in practices, right, and standards of care.
Thank you so much. Josie, any thoughts before I give you the next question?
I'll just add that, we do see so much familial trafficking in Alaska, and I think it's really important in all of our respective communities to really keep kind of open mind and awareness to the emerging trends and changes that are happening within trafficking. I have found that the moment I think that I have my pulse on what's going on, the next day that can change completely depending on a myriad of different things. I used to see quite a bit of a very specific type of trafficking. And then with the recent emergence of the fentanyl crisis in Alaska, how everything that we have known has changed very rapidly. And so I think that, not staying complacent in this is what the trafficking looks like, this is what we're used to, and only focusing in that, we really have to be dynamic and nimble in keeping up with the presenting issues of the day.
And in that regard, are there any new ideas or promising practices for serving the trafficking survivors that you think should be included in the standards of care?
Yeah, off the top of my head, I don't have the links to share out, but I will say getting the chance to kind of work at the federal level in some of these spaces, I'm really excited about the work that communities are doing. I think one thing that stands out to me right away is the Alaska Native Justice Center last year created their own trafficking assessment screening tool, and they did this by hosting talking circles like this with their community to figure out, how do we ask these questions? How do we create spaces that you can ask the questions and people can safely share their story? And they created a really beautiful assessment tool that's reflective of the community that they're serving. I think those types of really intentional practices in small communities and small groups are doing powerful things to change how we're doing this work.
Thank you. I appreciate all those comments. Thank you so much. Morgan, this person is a manager at a shelter where they house and support domestic violence and sexual assault and trafficking victims. Do you have any recommendations on how they differentiate their initial support when trafficking victims come in versus their standard of care for domestic violence and sexual assault? And training specifically, if you have any thoughts on that also.
Yeah, absolutely. So probably I feel like Josie, as having the clinical social work background, could maybe speak to the nuances of the sort of the beginning of this question, but I can speak to the final section of it. So really thinking about the training, because that's what do we do at MUSAC, is provide training and technical assistance support to advocates. And I think in terms of the training, often what we try to emphasize is that there's intersectional components at play, right? There's things that are overlapping. So, not assuming that a victim falls neatly into any one particular category of violence, right? That oftentimes there's overlap, and that those experiences that somebody has, like, this might be something where you're going to have to provide them with different services across the board, right? So it's really something to consider is, what does the victim need, and how are we providing comprehensive services that can really be specifically curtailed to fit their experience, and really allowing them to vocalize too at the time, at the point of contact, right? When they come in for services, what are you here for today? What is it that you're needing from us? How can we best support you? And also knowing, like we've already discussed, that those services may need to evolve and expand. And do you have the capacity to do that? And do you have the network to also, provide those services through, different organizations or different avenues if you do not have them in-house?
And Josie, she tossed that out to you. Do you have some follow-up?
Yeah, super well said, Vanessa. I think, I'm sorry, Morgan. I think you really nailed it, just staying in that seat of humility and learning from the person in front of you of what they need, and letting them guide that process. I don't know that I've ever worked with a trafficking survivor in the spaces that I've worked that also isn't experiencing so many other things. And I think it's really important, especially when we get put into these direct service roles or clinical roles. A lot of us are grant funded. A lot of us are being told we need numbers, we need to know the data, we need to get our grant reports together. And so we have this pressure to get the trafficking information because that's what's funding our program. That's what we're developing these standards for. I think as we have all of that on our shoulders, it can be heavy and it can be a lot, and it could make us want to lean in and jump into just the trafficking conversation. Morgan said it so beautifully, being able to step back and really recognize and see the human in front of you and the diversity of their experience and how very complex their needs are and changing. I think it's a beautiful, incredible experience to get to work with people who have such bravery and resilience. But again, letting them guide that conversation. And speaking again to Morgan's point, one of the most valuable tools I've ever had is community partnerships and relationships. So that if I do have somebody that says, hey, actually, I think I need to be in a domestic violence shelter, I need to be able as a service provider to not just hand them a phone number. I need to say, hey, my friend Linda's there. she'll take really good care of you. She's a great person. I need to build those relationships as a provider so that when I have built that trust and rapport with my client, I have that relationship and that network to share with that person.
Thank you. I appreciate that so much. And Vanessa, as we talk about developing these standards of care, access has been a discussion that goes on all the time. And this question is, what role does language access play in standards of care? And how do we overcome those language barriers?
Language access is so important. I recently went to an event and we were talking about cultural responsiveness and what that means. And one of the speakers indicated yes, it is food and it is language, but it's also so much more than that, right? It's people's values and beliefs and how to sort of honor all of those differences and nuances. So access is one of the considerations and is going to be a focal point as we draft this. Inclusivity, access, making sure that no one is restricted, making sure that we're not creating parameters and barriers to prevent folks. And we're really encouraging through the drafting of these standards to encourage service providers to make sure that they're considering all of these different aspects when working with individuals, right? What language needs they have, what cultural needs they have, what physical needs they have, emotional needs and supportive needs they have as well. And I think in terms of not only being proactive and inclusive in terms of language access and what that means in our written documentation and the way we interact verbally or in other ways with the participants in our service programs, also what kind of language are we going to use when drafting these standards, right? Like the same program that I attended last week, there was an entire plenary that was dedicated to Native issues, and sort of, a speaker talked about using words like triggers they don't resonate with the community. I use words like reminders and sort of really adapting the language to suit all of the different understandings and the terminologies and languages that communities use within their own context as they're serving different populations. So when we consider language, it's got so many different aspects to it, and all of these will be really important to be aware of and to incorporate in the standards of care as they're being drafted. That's a great question. Thank you for asking it.
Thank you so much. And Josie, both on the Presidential Council of Human Trafficking and in your work, what is your feeling on whether the standards of care will be applicable to all ages, specifically children? And how will this be ensured, or what measures do you think will be taken to make sure it's ensured? Will developmental levels be taken into account in the standard of care? I know you and I have talked about brain trauma before and thinking about that. If so, what do you think those different levels of standards would look like or would need to have in them?
Yeah, that's a great question. I think it's really important to talk about those different developmental levels and different age levels and working with survivors in any aspect. I'll probably leave some of the actual standards of care development piece. I'll hand off to Vanessa. But I do think, as we work to create these, we do need to have make sure they're accessible to people of all ages and all developmental abilities. I think that's just kind of standard practice in all of the work that we should be doing in our policies and our standards across the board. Are they accessible for different levels? But Vanessa, do you maybe want to speak more towards the actual development of the standards?
Yeah, again, with preface that we're still very much in the planning stages, but I do envision that there is an entire subcommittee dedicated to looking at the intersections with minors, right? Like there are different dynamics at play with minors. There's a lot of mandatory reporting nuances to consider, but then also that there are differences in the law. With sex trafficking, minors are automatically considered victims. You don't need to prove force, fraud, or coercion. With labor trafficking, even with minors, there has to be forced product coercion that needs to be proven in order for it to be considered labor trafficking. And additionally, I think one of the areas that is always contentious is this idea that, yes, they are minors, they're under the age of 18, and technically aren't in a space to make decisions for themselves. But these are also individuals who've experienced a lot of harm. And what does it look like to give agency back to those individuals and include them in the decision-making process about the services that we are customizing and wanting to provide to them? And there is a really meaningful space to include these minor survivors into the conversation at the onset, to make them decision makers in their own healing journey as well. And I think we tend to forget that a lot when working with minors, because there's this protective factor very much associated with it, along with all of the strict parameters that we have to follow when working and serving minor survivors. So just all of those different dynamics again, and I do envision that there will be a separate subcommittee that would work through what drafting those standards would look like for that specific population.
Can I add to that, Ingrid?
Yes, please.
I just wanted to say that, and Vanessa, obviously you would know this better, but just also like thinking hopefully that the standards of care will consider that interaction for and support for the parents of minors who have also been victims of trafficking, right? How do we support the parents being able to support the kids? Because that's a reality, and we don't know what the parents' stories might be, right, until we come into contact. But how do we sort of navigate that as well within the standards of care? What does that role look like for the family, the guardians, the parents, or the community supporting these youth, and sort of aimed at really focusing on uplifting their resiliency, but also like ensuring a bright future for them?
You know, and as a longtime former educator and tribal court judge working with many of these families, I really appreciate the effort, and that there's the intention of including those in the standard of care. Morgan, based on your experiences and knowledge of the care required, what are some of the most urgent improvements in the standard of care for trafficking survivors that you think are needed?
I think personally, from the conversations that I've been privy to, that really like that coordinated component and consistency with applying the standard of care is important, right? We've talked about being victim centered and having that feedback, that assessment of what do the victims need, and sort of, you know, what is that scope of work, and also being able to really, you know, focus in and curtail that to each individual, but also incorporating those traditional ways of healing. You know, how are we able to do that within the standards of care? That is so much needed. And just like the cultural competency around that, I think that's something that really sticks out to me.
And I'm going to bring that question out to all of you again. So for all of you, based on your experiences and knowledge, what are the most urgent improvements needed in the standard of care for our trafficking survivors? Josie and then Vanessa.
Yeah, again, to Morgan's point, that cultural component, so urgent and so needed, not just in our tribal communities, but in communities across the nation that are interacting with trafficking. I think probably most urgently for me is the training piece. I think we have seen in the last couple of years a huge push and momentum towards providing services for trafficking survivors and victims. And it has been incredible to be a part of that work, to get to be in some of the emerging spaces where we try to develop it and we try to figure it out. But I see so much harm being done when we're bringing in people to work in these roles without the proper training that they need from the beginning, and not just a quick 2-hour online module, but really intentional, deep training, so that when people go into these spaces with the heart to help, they're able to do that and do it well. I think sometimes just in our culture in America, we kind of throw people into the fire and then let them train themselves, and that can't be how we do this work. It has to be really intentional. It has to be thought through, and people need to be well trained.
Well, I understand being thrown into the fire. Vanessa?
I echo all of the above, but I would say that that's why these standards of care are so essential. I think the field has really expressed a need for it because services pop up and exist and are actively doing harm in certain instances without any degree of accountability, right? Like people are getting away with providing harmful services. And also people that want to enter the space want to do so with intention, as Josie mentioned, and what kind of tools are we providing them as a field to make sure that they are serving and interacting with survivors in a trauma-informed way and with the right resources at hand. So that's the approach that we're using as we're developing standards of care. We recognize at the offset that different communities, different entities, different states, different, there's so much diversity. Not everyone has access to the same kind of resources. Not everyone has access to the same kind of funding. Funding comes and goes. So like, how do you, within all of these different moving dynamics in your realities of providing services, how do you still, at the very baseline, ensure that you're not doing harm? How do you make sure that you're still centering survivors' experiences and are being trauma-informed and culturally responsive and equitable in the services that you're providing? We're looking for some degree of consistency and uniformity, of course, within the context of adapting and making that service program individual to that individual survivor as much as possible. But how do we ensure that across the United States that there is some degree of consistency in the way that services are provided, and to ensure that a survivor, no matter where they are geographically on the map, are not experiencing any further harm at the hands of service providers. So that's our goal. It's a lofty goal, but I'm hoping that with all of the collective wisdom that exists from the membership within this project, but then also from the larger community, and hearing about individual community aspects and dynamics that you experience, will help really inform this process in a way that's intentional, but also create that richness and create that guidance that service providers have expressed that they need so much in the work that they're doing.
So we're getting close to the end, and I just want to give everybody kind of a weather check. We're going to get one or two more questions out of the chat. Please know that all the questions will go back out to the panelists, and hopefully they will have the opportunity to share responses back out with you. But the other things that are happening at the end of this, I'm going to ask the panelists to share with us the one thing that they want participants to take away from the conversation, and then we'll kind of start moving towards wrapping up. There's a couple of things that have been asked for that are just really specific things. Does anybody know of a flow chart right now that exists for the standards of care? And I'll just open it to any of you. No, I'm seeing a lot of no heads. Okay. And then the other one was Resilient Nation with FEMA. Is somebody familiar with that, and can they talk to that? Again, no. Okay. Now, the next question, what would you recommend as a health provider? How can we provide and support the best possible care to Indigenous peoples that are survivors of human trafficking? Are there cultural differences and that I could be more aware of, again, as a healthcare provider? And I'm going to start with you, Josie.
Well, that's a great question. I think the fact that you're even asking that is the lens that we need, that in our different roles, whether it's healthcare or law enforcement, educators, we're asking, how can I be delivering the service to the person in front of me in the way that's most impactful and safe for them? I can't speak to all Indigenous populations and tribes, but I know that, for me, it feels very safe and comfortable to me to go into a provider's office that is part of my own Native healthcare organization. And that displays my culture's values and artwork and principles within the building and within the spaces. I have the privilege of receiving healthcare at a facility in Anchorage that is Native owned, and I have ownership of that space. I belong in that space. So I think that sense of belonging and welcoming is a really important piece, especially within structures that can sometimes be, there can be some history of trauma and some things that come up for people in there. I think the most important thing to do is familiarize yourself with the Native populations that are in your area. Whose tribal lands are you on? Who are the people that are ancestral residents of that land, and get to know their customs and learn from them. I think also asking the person in front of you what they need and what they're most comfortable with is always my best approach. Ingrid, you're muted, I think.
Morgan, you can't answer the question if you can't hear it. What would you recommend to help the stigmas created to people in the community who are faced with judgment, living in rural areas where community is against each other, and how would you help in building those bridges to mend the stigmas?
Yeah, that's a great question. I love that question. Thank you for giving me this opportunity to answer it. So in the work that I've done, as I've also worked in evaluation as a consultant, I always advocate for going back to the community and trying to extrapolate information about how do they understand or perceive something that's happening, right? A situation or an issue. So I think, one of the things that does is really sort of gives you like a baseline, right? How are people understanding this? Where are the gaps of and shared knowledge, right? What are the misconceptions, and how can we sort of meet people with where they're at? Not everyone will end up on the same page, right? Or want to be on that page, or whatever that looks like. Not everybody will have an interest in understanding an issue to the same degree. So it's really important to understand too, when speaking about that, like the intersectional identities also that are, the intersections that are coming into play. I think that, there are, like I said, misconceptions about, even within the tribal communities, there are misconceptions about intersections and, the different identities that people hold, those experiences. So really educating and sort of, unweaving sort of how did this come to be, for example, and going back to what Josie was saying about sort of these traditional ways of knowing and culture and understanding customs, and how do different tribes, what are the narratives there, what exists, how have we historically understood our people, right? And really getting back to that identity that we share, right? That respect and that wisdom and that knowledge and understanding who we are as as Native people. I think that using that as the basis to really sort of transform the way that people think by, educating through really those traditional ways of knowing, and emphasizing, being able to have different resources and materials for, different age groups and populations, and really being able to be truthful and transparent and building that trust, like I mentioned before. So providing people with an avenue to discuss these topics. I've seen community forums in certain communities where people have discussed different topics related to different identities. And a lot of times what I've seen come out of the conversations is, oh, well, I didn't know this. I didn't know this existed, or I didn't know this was something that people experienced, or I didn't know how to respond. So allowing people to have the space to have those discussions is really, I think, probably the first step.
Wow, I've always learned so much from these roundtables, and you guys just have challenged me throughout this session. Vanessa, could you start us off and share just one thing that you would like participants to take away from this conversation with us?
Thank you. I would say that, this is an important time in the field where we have the opportunity to really course correct to a certain degree, but then to also provide a really intentional resource that entities and organizations and individuals even might be able to apply and enhance in their existing practice. I know as an organization, we are drafting these standards of care, but I want you to know that they're not happening in isolation. This project, we intend it to be extremely transparent, and we welcome everyone to walk alongside throughout this process. Please feel welcome to share your wisdom and your insight with me. We're building a team. We really want this to be for the field, by the field, and we can only do that when the doors are open, where people feel safe to share their wisdom and insight in order to really inform these standards, because we really want it to have utility, and we want it to create a baseline for continued improved work as we move along in this field, and continue to hold the experiences of survivors in our work, but then also to continue to support survivors in their healing journey. So I invite you, thank you for being part of this conversation, but I also invite you to continue to have this conversation and challenge us with questions and ask questions, and just help us be a part of the process to create a resource that will hopefully benefit a lot of folks. Thank you.
Oh, so excited. Josie, one takeaway for the participants that you'd like to share?
Yeah, my takeaway to all of you working in these spaces in direct care, who are really the boots on the ground that are making the difference, that are sometimes learning the really hard way and experiencing really the weight of this complex issue. My takeaway to all of you is to use your voices, use what you're learning every day to inform programs like this, programs at the federal level. If something within a system isn't working for the person, the survivor in front of you, use your advocacy to change it. Use the voice that you have to uplift the stories of so many people that you are all interacting with every day. You are in a powerful position to create change and to really take those stories and create something that can help make better systems, better advocacy for so many people. I think learning circles like this are the perfect example, but I encourage you all, please get involved at a state and federal level. Please get involved in how the laws are impacting the populations you served. Please get involved on how changes in our federal government are impacting. All of that is so important, and your work deserves to be lifted to that level.
So important. I really appreciate that. And Morgan, same question. What's one thing you would like the participants to take home with them?
Thanks, Ingrid. Do this work in collaboration with others. I mean, if I can say nothing else, it is that this work is hard work, but it's our heart work, right? And don't do it alone. We can all be subject to burnout. It is immensely stressful. It is challenging. I think when you care a lot, to leave things at work, right? I know I struggle with that myself. It's real hard not to internalize or bring things with you and carry them with you. But it's important for us to really have a network of colleagues and providers and others that can support us in this work. And remember that you are not walking through this journey, through this work alone, that we are all here with each other, and that we are creating these amazing new pathways for being able to support and better advocate for victims and survivors, and that everybody has a part in this. So Thank you all so much.
Oh, Kagasa-kun, Gunashi, Jamai, thank you all so much. And I'm so glad that you've added to my circle. Josie and I met once sitting down next to each other and have continued the work since. And I'm hoping that both Morgan and Vanessa will do that with me as well. So thank you so much, Vanessa, Josie, and Morgan, for being here and sharing your experiences. Thank you to all the people that participated. I apologize if I didn't get to your questions. I know that the center will try and get responses back to you. So I appreciate you all sharing all those great questions. We just truly appreciate you being here. And thank you again to the Human Trafficking Capacity Building Center and the coalition that helped make this possible. We're looking forward to you joining in future talking circles. Please take care and be safe out there. Thank you.